Hi everyone, Dr. Jeff, audiologist and director of Ear Care Specialists in Nottingham. Thanks for joining me. This patient had occluded ears and their right ear here was particularly bad. They'd been feeling blocked off and their hearing was down for a number of weeks, if not months. And we are just about to go in and take out this first chunk of wax. You'll see that there's some skin trails there. This was a combination of both wax and dead skin reels. We'll zoom in a moment and you'll see this first large plug that we extract from their ears, and it was pretty big. And here we go. So giving it a little wiggle, just grabbing hold of the skin, and out it comes. And with this first one, because it was quite large, and you'll see the skin trail there, I thought this might be the full entirety of the wax, but actually we head back into the ear in a moment and you'll see there's plenty more behind it. So that was the first plug of maybe 3 or 4 plugs to come out of this particular ear canal. So go back in, it really looks no different, still completely occluded, and we go again for round 2. Again, you'll see that it's moving nicely, so it's mobile, it wants to come out. Second plug comes out there. At that point, the patient just has a little look. I think they can't believe it as well. We go back in, and still no sign of light at the end of the tunnel, so no view of the eardrum yet. Just another wall of wax. So back in, suction on. Giving it a wiggle, so again, no concerns about the wax being sort of firmly stuck in the ear. It was moving around, so I was fairly confident it was going to come out for the patient. That bit goes and just gets sucked down the suction. So that was number 3. On to the next bit. And again, just slowly wiggling it and pulling it free. You can then just see the eardrum there, so there's a glimmer of the eardrum now, which is great. Take that bottom portion away, and there's the bit on the bottom of the ear canal. Lift that out. So the patient's hearing now is going to be markedly improved. They actually described it as having HD hearing. And back in we go. So you'll see there's a little bit of wax just on the floor of the canal, which we could leave, but I wanted to get that bit because I knew that I'd be able to grab it without any bother. And then there's a bit more up into that top left attic region. That's getting quite close to the eardrum, but it's not actually on the eardrum. So I just talked to my patient, explained that we're going to go in a little bit deeper in a moment to grab that final section. So we get this first bit on the floor of the canal, which is quite easy to get. So we just suction that bit up. Comes up quite easily. So that bit's gone, and then we look at the larger bit lurking deep down in the ear canal. So with this bit, again, having a microscope, being able to zoom in is important, and I just get the patient to tilt their head away from me to give me a straighter view up towards that attic region of their eardrum. So you can see it there, it looks a bit larger with this angle. And again, we grab and pull it out. So there it is, all gone. There is a very thin, sticky patch of wax just staining the eardrum at the top there, which you can just about get a glimmer of. There it is. We don't touch that. That's on the eardrum, and it is actually superficial. We did a pressure test. The eardrum was moving fine. So there you go. Thanks for watching.